My research is aimed at interacting with them more, and I believe that most of the researchers out in the field doing, and researchers as well as healthcare professionals working with people with dementia, feel like it's best to interact with them more. And because when somebody has dementia, when they're left alone and isolated, it's hard for them to know where they are, who they are, their place, and everything. And I think that's when some of the depression and anxiety can really set in, is when they're isolated. So most of the research has been focused on me as the professional communicating with the person with dementia to get them to do what I want them to do. And that's people with dementia no longer have normal social interactions or routine social interactions, because it's difficult for them to engage in a back and forth conversation, and so then they become excluded from the socialness of just talking between two people, and that exclusion decreases their self-esteem and increases their stress and anxiety, and they lose their place in society. People with dementia are so anxious about who they are and where they are and what their place is in society that anxiety translates into increased memory and behavior problems. People with dementia, they react in many different ways. It's not a predictable progression. Some people with dementia who have just been very calm and sweet and a wonderful personality, when they develop dementia, their personalities can change. Some people stay exactly the same, and some people change a lot. And so there's no norm in people with dementia. It's difficult to initiate a conversation with people with dementia because you have to initiate that conversation in a way that doesn't require them to remember something. Because if they can't remember something, then they're going to be embarrassed or feel like that they're lesser than. So be sure to not ask them specific recall information, and then wherever the conversation goes, wherever they lead you, go with them. Don't try to get them to come back to the topic of conversation. Go with them wherever they go. And so that's out of the norm. We don't do that with people in normal social conversations. We stay on topic until the topic changes. But with someone with dementia, you may be on 5 topics in one 15-minute conversation. And so the professional, the person talking with the person with dementia, has to be okay with that. Some medications for Alzheimer's disease, but they are largely ineffective. The medications help about 20% of people with dementia, and they improve their memory about 20%. So it's kind of like the rule of 20%. It helps about 20% of the people, and those 20% that it helps, it improves their memory by about 20%. What medications do more of is they keep the person plateaued rather than they decline slower. Their memory declines more slowly. And some of the people do receive a small improvement in memory, but it's it's a very small improvement, and then really what really happens is a slower decline.
It's called the EEG. They put wires in your head. It doesn't hurt. That's how they test your head, your brain. And he said that I did need some help. That's why they gave me the Namenda. The Namenda is the one for it's helping me so I won't forget so much, like my grandpa, with the dementia. Mm. Mm-hmm. More that I know now. More. Yeah, what I'm doing, I hope. Later on, because I'm getting old and old.